you for co-chairman. My name is Dr. Laaphไพfrom Persisted Horizontal Thailand. This is the first time that I will propose Persisted Horizontal Joint Line for the Universal Alignment concept, which I knew this for more than 15 years in my total year to classroom. There is no conflict of interest in this topic. In principle of the TKA, the hip knee ankle or HKA parameter is the best surrogate for the maximum longevity of the prosthesis. The HKA parameter just built for only knee function when both legs is standing or position. However, the real knee function is not just only standing but also walking, stand, climbing, and sit to stand or vice versa. Do we have a better parameter that can represent our knee function in the real world? I would like to propose a new universal parameter which better than HKA for all knee function, that is persistent horizontal joint line concept or PHJL. In this X-ray, even the left tibia has a wireless cut, but after standing, the PHJL still maintain parallel to the ground floor. So PHJL is really consistent in the real functional knee because the effect from the ground floor relation to foot, high foot, ankle, knee, hip, and up to the lower spine. In this study, either standing on two legs or one leg, the PHJL still maintain horizontal, but CG has a little bit shift to the side when changed to one leg standing. For dynamic knee joint line study, they found that when walking, running, PHJL keep between -3 to 6 parallel to the plane of the ground floor. When standing with one leg or two legs, the PHJL still parallel to the ground floor in between -2 to 6. In conclusion, at all functionally, the PHJL will be maintained within the boundary -2 to 6. If we use a C-pack joint line, oblique or JLO, it will roughly approximate from the apex distal 2 degrees to apex proximal 6 degrees. Mechanism of subtalar and foot compensation can be explained by cross-chain reciprocal reaction from ground floor. Cross-chain reaction would happen by a previous and antagonistic function of the muscle developed on the cross-chain reaction from ground floor to the center planting of the body. So PHJL naturally horizontal to the ground floor because of the combination compensation balance force from the foot and subtalar joint chain up to the knee joint. In the real world, PHJL will more consistent than the mechanical HKA, and new boundary box of the HKA always be close to the center of the tibial plano. In some cases, with failure totally arthroplasty, for example, surgeon set up the mechanical axis earlier beyond 10 degrees. For some patients have a chronic ankle foot pain and finally also arthritic ankle joint. Is that because the ankle and foot cannot compensate for too much mechanical action earlier. Another example, the effect of the cross-chain reaction in flat feet and road transfer from the metatarsal to high foot, ankle, and finally will end up with broken deformity of the and greater muscle arthritis. I do simultaneous bilateral totally arthroplasty for more than 10 years is my routine service. In this year, the right knee ankle foot was long, so surgeon can use standard HKA to set up totally alignment. On the left knee, have the ankle foot deformity by external rotation of foot, while the subtalar joint make the setup for the possible tibial cut go to direct it earlier cut. If surgeon decide to use the second toe alignment, they will encounter with the broadest possible tibial cut. In this situation, PHJL is more reliable and accurate than HKA alignment. The most really easy way to simulate PHJL in the operating theater was starting from the proper setup foot line on the operating table. Then make sure that the tibial alignment perpendicular to the surgical table. Surgeon have to move to standing at the end of the table and look straight backward to the tibial alignment and then use the water level interceptor to confirm the possible tibial cut which will parallel to the ground floor and simulate the real function needs specific in this abnormal ankle and foot deformity. Surgeon can easily adjust the proper water level by sliding medial or the lateral alignment at the ankle. Most of the TKA can use HKA alignment for the best longevity prothesis, but using the second toe for the sagittal plane alignment is not consistency. So PHJL is more universally reliable parameter than HKA. In summary, the new PHJL is much better than HKA if considering in real-world function, and we can easily use water level to simulate PHJL in operative theater without need of any special instrument. These are some of versatility of the PHJL from me today. Thank you for your attention. I would like to thank my fellow Mongkol Chan for the prepared this slide. Thank you.